Hello, Facebook. I am Dr. Myla Bennett of Ederra Plastic Surgery and Medical Spa in Johns Creek, Georgia. Oh, my face is peeling. I'm like, what's that on my face? Happy Martin Luther King Day. I decided to talk about, hi Tessa, I decided to talk about my consultation fees so people can watch this video before they even call my office, reach out to my website, slide in my DMs. This has been, people for some reason really don't like consultation fees. So I'm going to explain to you why I will always have one, and eventually it will go up. So if you're interested in being taken care of by me from a surgical standpoint or a skin standpoint, I will happily explain to you why I must charge a consultation fee. Hi, Mandy. Hi, Crystal. Hi, Ayana. Hi, Shawana. Hello, Brandy. Hi, Taisha. Yes, Mandy, time is money. So I got a rather irritating direct message. Was it Friday or Monday? A few days ago on Instagram, and a person felt the need to write me a very long message explaining to me why she went to someone else for a consult and didn't come to me because I charged $150 for a consultation fee. And she explained that I need to lower my price to $50 so that people like her could go to 6 or 7 plastic surgeons and consult, because people can't afford to spend $150 for 6 people. And she probably would have chose me because I do pretty good work, which to me was shade, but maybe she didn't mean it like that. She kept talking like it was like, oh, you do pretty good work. I probably would have chose you because your demeanor and you're honest. And I love watching your videos. I watch all of your videos, blah, 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 blah. And I'm thinking, and then she told me that if I lower my consultation fee to $50, my business will blow up. I wished her well with her surgical journey, because I do wish her well. And I told her I know all her results will come out great, and I'm positive she chose the right person, and went on about my business. But one thing I want to say is, first of all, don't assume that you know what I want, and don't assume that you know what's going on in the walls of my business. So right now I'm attracting exactly who I want to attract, and not attracting the people who I don't want to attract. So everything that I do is purposeful, and my time is valuable. So I sit on Facebook when other surgeons are asleep and teach you guys for free. I teach for free. I've had multiple people, including that person, who said that my voice soothes them. I have people who fall asleep to my voice. Like, I take time from my day. I take time away from my children to come on Facebook and YouTube and Instagram, and I teach lots of information for free. And that is the extent of my free services. If you want to know anything outside of the free information that I give willfully, and I've been doing for over 3 years, if you want to know something outside of that, you have to pay for my time. I am a surgeon. For some reason, people have no problem paying a hairstylist, a lash artist, all kind of other people, the mechanic, the carpet cleaner, plumbers. They charge you to come out and assess what's going on in your house before they even give you a bill. But for some reason, a surgeon, I am a surgeon. I'm a surgeon. A surgeon. I don't have, and no, not to downplay anybody else's career paths or choices, because we need all of them. But I didn't go to school for a year or 6 months to get a certification. I didn't take a weekend class to learn how to do lashes. And for some reason, people don't have a problem paying those folks for their time, but it's a sin for me to ask for you to pay for my time. My office, I have a staff who rely on me to bring money in to pay them their paychecks so they can feed their families. I have children that I need to feed and I need to eat, so I can't work for free. So if you don't, after learning all the information you can about me on Facebook, which I have hundreds of videos on Facebook that you can go about and listen to what I have to say about any topic in plastic surgery and skin. You can go on Facebook and find out exactly what I have to say about that thing. If after you do that, you still need more information, it's time for you to pay me. And the reason why I have a consultation fee is for people like the one who went to see 6 people. If you are going to see 6 people to make your decision, which is all well and good, and you're right, and I urge you to do that if that's what you want to do, it's smart for me to charge a consultation fee, because the likelihood of you choosing me when my work is just pretty good, the likelihood of you choosing me is slim. So now I've sat with you in my office, my staff, I had to pay my staff to greet you, process your paperwork, probably communicate with you on through email before you even book a consult. I have to pay them to do that. And then you go and choose another surgeon for your surgery. That means I work for free, and my staff, they didn't work for free. I still got to pay them. Like, that doesn't make any sense. So if you are offended by me needing to exchange money for my services, if you're offended by me needing to do business the way every other person does business in this world, then go to the other surgeons. So I feel bad for the other 5 surgeons, especially the one who did one for free for her, who got no benefit from it because she chose a different doctor, which is her right. And people like that is who I'm not really looking to have in my office. I don't need that kind of drama in my office. And I also don't need anyone to tell me how to run my business. So when you open up your plastic surgery practice, you can charge $50 or free for your consults. But in this plastic surgery practice that's owned and operated by Dr. Myla Bennett, I will do it as I see fit. And probably by 2020, my consultation fee will be more. So that's all I had to say about that. I don't work for free. Yeah, I don't work for free. That's all. I have $270,000 worth of debt from student loans to educate myself, to be able to offer safe surgery to the people who appreciate my expertise, and to the people who think I do great work. If you think I'm just pretty good, you probably shouldn't come to me. You need to go to somebody that you think is great. So that's what I had to say about that. People, I don't know, and people for some reason think that they get a vote on how you run your life, how you run your business. I don't know. Like, I love everybody who support my Facebook Lives, and I will continue to teach and share for the people who appreciate it and want it. And if you don't like it, you can not come watch the videos. But I don't know you all. So I don't need really unsolicited advice on how to run my life, raise my children, or run my business. And that's all I got to say about that. Sometimes Black people expect discounts from Black-owned businesses, but wouldn't ask a white surgeon for discount or free services. You know, Kiera, you are absolutely right. Because I know some of the stuff that people say to me and expect of me, they would never say to a white surgeon. Ever. Especially a white male. It's just sad, but, you know, it's sad. I was so offended by that long message that I'm like, you obviously are bothered because you chose another surgeon and you sent a message that was like a dissertation in my inbox, basically telling me you could have had. She actually said you could have had this money. I'm not hard up for money. I don't work just for money. That's where people don't understand. I have no desire to run a plastic surgery factory. I don't want to do 5 BBLs a day. I actually don't want to do any BBLs a day. I don't like BBLs. So for the people who think, oh, if she lower her prices, or oh, if she did this, then she would have way more business. You don't know what business I have, first of all, and you don't know what business I want, second of all. You have no idea what my dreams and desires are. You're making a lot of assumptions that you're likely wrong about. So to that lady, I'm pretty sure you'll watch this video at some point. I was extremely offended by that rude message that you dropped into my inbox. Good luck with your surgery. I wish you all the best with your free consultation. My partner asked if you charge for 10. I said, yes, done. She's worth it. I can't wait to get my BMI down to come see you. Oh, thank you. Right. Well, Shawana says she has to pay a deposit for her stylist. It's business. Like, it's not, it's my livelihood. I have overhead. It costs money to take care of people when they come into this office. Like, it's not free. I can't work for free. And I don't want to work for free. I don't want to waste my time. When I do my consults, I spend a lot of time with the patient. A lot of time. 90% of the time, my staff for new consults, and if anybody is on here who do the consult with me and can speak to this fact so that people know I'm not just saying it and they know it's true. 90% of the time when I do a new consult, my staff has to come in the room and get me out because I'm in there so long. I take a genuine interest in the women that I do surgery on. You're interviewing me and I'm interviewing you. Just because you come here doesn't mean that I'm going to do surgery on you. Just because you pay $150 to meet me doesn't mean you'll get surgery if I don't think we are a good fit. Because my motivation is not dollars. My motivation is making women feel good about themselves and help them look like the way that they look, but more importantly, like the way that they feel. And I have to get to know you in order to be able to do that. I can't do anything about the way you feel about yourself if all I care about is making your stomach flat. So I put a genuine interest in my patients, and my surgical patients, if they have access to me, they can call me, they can text me. My personal cell phone number that my mother has is what my patients get. And so I also need to figure out if you're crazy before I'm going to take you on as a patient, because you can't have my cell phone number if you're crazy. So it's an interview, but for me and you, people for some reason think that the only person that's being interviewed is me, and that is so far from the truth. It don't make no sense. So I feel like I dodged a bullet. That person, I'm grateful that I had a consultation fee because it turned off somebody who may potentially not be, playing with a full deck. Because to put all that in somebody's inbox who is a total stranger to you, I will never understand why people do that. Tamara Tipton, I had a FaceTime consult and liked how I didn't feel rushed at all, and she made me understand that what I needed and wasn't in a hurry to get me off the phone. She's amazing. Thank you. So I just wanted to explain to people why I have a consultation fee. The consultation fee comes off the price of your surgery. If you book your surgery within 7 days of the consult, we take the $150 off of the price of your surgery. So if you know that you're serious about surgery and I am a real option for you, you're not paying for a consult. It goes towards your surgery. But if you're playing around or you're interviewing 20 surgeons, then I should be paid for my time. And if it's something that you want to know, 9 times out of 10, short of exactly which procedures I will recommend for you and how much they will cost for you, you can find it on my Facebook page in one of the hundreds of videos that I've done for free that I've taken time away from my children in order to be there for you all on Facebook. You can watch one of those videos, and those are absolutely free. Thank you, Taisha. Yeah, people spend $150 in a restaurant and don't complain. They spend $150 on concert tickets, spend $150 on shoes, all kind of stuff. And that's their right. I don't ever try to check people on what they spend their money on. You have a right to spend your hard-earned money on whatever you want to spend it on. And I have a right to charge people to see me for my surgical expertise that I spent 16 years attaining and $270,000 worth of loans to educate myself. I have a right to charge you for that. I didn't do it. I didn't go to school to become a plastic surgeon to be 100% a philanthropist. That's not why I did it. I did it to make a living for myself and my children. So outside of my Facebook Live videos, which are free, you have to pay for my knowledge. Right. I think the reason she was complaining is because she consulted with 6 surgeons. So, she didn't want to pay that for 6 people, but that's her personal issue. That don't have nothing to do with me. Who you see is your business, has absolutely nothing to do with me. I don't know you. So I'm not going to make my price based on a stranger that I don't know who wants to consult with 6 different people about one surgery. That has nothing to do with me. That's personal. I shouldn't have to explain it, but it keeps coming up. And for some reason, people think they're hurting me when they decide to choose someone else. There's lots of different things that go into play when you decide who you want to get in relationship with from a surgical standpoint. And for me, when I decide who I want to get in relationship with from a surgical standpoint, I want somebody who believes in what I do first. And if you don't believe in me enough to think I'm worth $150, I'm not sure that I want to be in relationship with you, because it's a long-term relationship. Once I cut you, you're mine for a long time. So we need to like each other and we need to respect each other. I need you to believe in me. I don't need somebody to think I'm just pretty good. I need somebody I want people to come to me who think I'm the best. And you should go to the surgeon that you think is the best. That's who you should go to. That's not going to be me for everybody. I understand that. I'm mature enough to understand that. And so the question is, does she have to pay them as well? And so who's losing money? I'm not understanding the question. Some of the people she paid consults fee and some she didn't. See, Jessica Steinacker, she paid $1,000 for a consult with her plastic surgeon. She believed in her surgeon. That's how it's supposed to be. Yes, I do phone and virtual consultations, Kim Cerna. That's right, Shawana. That's what I figured. I know I shouldn't have to explain it, but I am. I'm going to go ahead on and explain it. And it's a part of, yeah. Right. I think my videos are a blessing and a curse, because people, when they watch my videos, especially the people who watch like all of them, they feel like they're my friend or something, which is I think why that woman was inclined to insult me in my direct messages. Like it was so insulting and I was so irritated. I think that's why she was inclined to do that, because she probably thinks she knows me, but you don't know me and I don't know you. If you come to my office or have a consult, we will get to know each other and we'll probably become friends, because I'm friends with a lot of my clients. But as long as all we're doing is communicating with each other right here, we don't know each other. So, but people think they know me and they get a little bit too comfortable, and the disrespect is starting to get under my skin. It got under my skin this weekend. Thanks, Tabitha. So for all of my Pretty RX people who are, my manufacturer has been dripping the products to us slowly this week. We got one more batch, and it's supposed to get here today. Lord, it's just been taking forever. So the last batch of stuff should get here today. The kits are packed up with the exception of the products that need to come in today, and they will be shipped out. If they come at end of day, it'll be shipped out tomorrow morning, but your kits will be out in the next 24 hours. And on the way to you, so that you can start looking young and having glowing, fabulous skin and aging backwards and all that good stuff. You are giving free consultation. I want my money back. Regina, I'm not giving free consultations, child. Honey, this whole video was about why I don't do free consultations. Okay, let's see. Right, quality over quantity. That's right. I'm not trying to become a factory. I won't become a plastic surgery factory. I literally won't do that. I have no desire for that. Right now, I don't do one-on-one mentoring with people. My schedule is way too tight. So, I speak to groups. If you have a group of medical students that you like me to speak to, I'm happy to do that. But my schedule is way too tight right now to do mentoring of individuals. Thank you, Sandra Rodriguez, and congratulations on your weight loss. I'm trying to lose weight myself. I lost 4 pounds last week, y'all. I was doing keto, and my trainer, I'm back working out with my trainer. He was kicking my tail all last week. Yes, I felt very disrespected, Mickey. Hey, Dr. T. Hey, Dr. T. Dr. Yolanda Thomas Barrier, she's a trauma surgeon. She's one of the people who trained me. I remember, I think I was a third-year medical student. It was right before I started third-year resident, right before I started my plastic surgery training, and we were closing an exploratory laparotomy So it's like a big, long midline incision. And she was teaching me how to close like a plastic surgeon. She's like, no, she let me do a subcuticular stitch, which you normally do staples, just so that I could practice my closing. She is a fabulous trauma surgeon. That's right. Yep. Shanna, you are so right. Do people not realize if you did free consults, who's doing your surgery 24 hours in a day? Yeah, they are having the helpers work on them. You got that right. That's exactly what's happening. Yes, the consult fee, Elise, is put toward the surgery if you book within a week of the consult. Oh, Regina Taylor, thank you, sweetie. Thank you, Deirdre. That's right, mommy. Ernestine Bennett, that's my mom, y'all. That's my mommy. Lipo starts at 4K, Nicholas. All right, Shawana, I'm here. For Pretty RX, that's a good question. So Nicholas Bernard asked if I charge a consult for Pretty RX. So Pretty RX, that company is a separate entity from Ederra Bella. It's my company. But the purpose of it is to help people be able to be on a skincare regimen that is a good one, a medical grade skincare regimen. And I put together kits based on skin concerns so people can, when my official website goes live, you'll be able to click on your skin concern and then it'll list the kits or products that are appropriate for you. You don't need a consult to order Pretty RX. If you want me to say a custom regimen just for you, then you have to pay a consult. But I'm setting this company up to make it so that it's sort of do it yourself so that you don't have to pay for a consult fee and can still be on a very good skincare regimen that will help you age backwards. I'm going to roll out my website in the next 2 weeks, the official website. Right now, you can just order kits on my landing page. It's www.prettyskinkit.com. And in April, I'll be rolling out something a little even. I'm going to announce that later. But it's something that's even more in depth to help people basically figure out the things that they should be doing to take care of their skin without physically having a doctor involved with the process. So to order Pretty RX products, no, you do not need a consult fee. Pay a consult fee. You just go to the site and pick the kit you want. But if you want more one-on-one attention from me, then you have to pay for a consult. Thank you, Dr. T. The website for Pretty RX is www.prettyskinkit.com. We're actually probably going to add a few more kits to the landing page today because my official website, it's been taking longer than I thought to get it ready, but we're trying to make sure everything's right on there. It's a lot. So I'm going to add a couple more kits today, because when my final shipment of products comes in, we'll be able to take orders from everybody. Thanks, Tange. That's right. Thank you, Nicholas. You remember Dr. Thomas. That's right. We had many. I remember one of the cases I hated the most was with you too. It wasn't your fault that I hated. It was a perforated cecum, and it was like the middle of the night, and we were in there doing that case, and I was like, "Why am I here?" Like I was like, "This is the worst." It was just. I mean, we saved that person's life, but it was like, the cecum is the first part of your large intestines, and so it's where the contents of your small intestines, which is called succus, it's like the food after all the nutrients have been kind of taken out, and it's like just before, it's not technically considered stool yet, but it's brown like stool and it's watery. And it goes into your cecum, and once you get, the cecum is the beginning of your large intestines, and your large intestine is what takes all the water out of it to turn it into formed stool. And so if your cecum perforates, it's wet, it's like pre-stool and it's wet. It's like loose. And if your cecum perforates, it's all in your abdominal contents. So this person's cecum perforated, and it was like all this succus in their abdomen, and it was like corn floating in it, and it was just so gross, and it was in the middle of the night. And I remember thinking, why do I want to be a surgeon again? And Dr. Thomas was all happy fixing that perf cecum because she's a general surgeon, and that's what they love. And I was like, wow, I can't believe you like this stuff. You remember that night, Dr. Thomas? That night was seared into my mind, and I remember thinking, what am I doing? Like, do I really want to be a plastic surgeon this bad? All right. That's right, Dr. Thomas. Thank you, girl. Thank you for sharing that and letting people know what I stand for. You can book for a 2020 consult date if you want to. Can I consult and book for 2020 date? Oh, for 2020 surgery? Yes, you can. We would have to, the surgery center that I use, they won't let us book out that far. How far do they let us book out?
I think like 6 months.
But what we can do is put you on my schedule, and when we hit the 6-month mark from your surgery date, we can put you on the OR schedule. But you can book my schedule. At least I'm not sure when I'm coming to Ohio. So I was gonna come to Ohio in February, but I'm having my launch event for Pretty RX in February, and so that's gonna be too much for me to do both of those things in February. So I'll probably come to Cleveland in March or April. That's right, Tiffany Lynn. So she says, any doctor doing free consultations needs your business and money, from my opinion. And if I think you're just pretty good, you could never cut on me. I would stay fluffy and fabulous. That's right. I'm not rich, but I save for what I want, and I want the best. Don't need 6 doctors to know that. Thank you, Tiffany. That's exactly what I thought. I was like, if this chick called me pretty good one more time, I'm going to block her. I was like, this is all the way shade. Like, I mean, folks just shady. Honey, just shady. Aw. Oh, Sierra. Oh, I remember you, Sierra. You said puberty's kicking your butt. Oh, Lord. What do you put on your lips to moisturize? This is what I put on my lips. Today. That's what I put on today. MAC lip gloss. I'm going to come out with a lip gloss line. It's going to be called Myla Rose. But that probably won't be until 2020. Thank you. Yeah, my skin, I had good skin before I started using Pretty RX. My skin is peeling though, sorry. That's my retinol. I had good skin before I was using Pretty RX, but my skin got better. It's way glowier, but the reason is the products I used before didn't have a lot of hyaluronic acid in it. My products have hyaluronic acid in everything. Everything in my line has hyaluronic acid in it except for the sunscreen. So it made my skin much more vibrant and glowy. It looks like I have on bronzer when I don't. Like, my products are the bomb. Recovery after a wake lipo is 48 hours. You got to wear a garment for 3 months though, but you are up and at them in 48 hours. I'm 41, Sandra. I use my products exclusively now. I've been using my products exclusively since October. I don't do fibroid surgery. I've taken uteruses out when I was in med school, but helped. I wasn't doing the actual surgery. I was assisting, but no, I don't do that. All right, Carla, thank you for the shout out. So you saw that from Carla Lynette. She had a wake lipo 11:30 and was in the mall shopping on 12/2. Mommy makeovers vary based on what procedures are in your mommy makeover, for Lander. Amanda, I'm about to start coughing. Can you give me some water? Is it a patient here? Dang, y'all. I got a consult, and she paid the $150, so I got to roll. I'm sorry, I got to run something. I was killing time until my first consult started for today. So This patient paid her $150, so I'm going to go and give her my undivided attention, and I'll check y'all later. I'm Dr. Myla Bennett of Ederra Plastic Surgery and Medical Spa in Johns Creek, Georgia. You can reach me on my website at www.ederrabella.com or call my office. I'm about to start coughing. At 678-325-0006. All right, bye.